dear semester. As you know that starting from the 1 by 1 topic, I am discussing with you the important questions related to your exam. Might be. So, yes.
I didn't know.
You know that this is the area which is lying under this liver, and this is the second part of the duodenum, and here the side, this line indicates the passageway from the greater sac to the lesser sac. And you know that this is the edge which is formed by the gastrohepatic ligament, and its free border contains these structures. You see the hepatic duct, portal vein. The hepatic duct, portal vein, and the hepatic artery. So, if I say to you that the cystic duct is present in this area, lying in the free edge of the gastrohepatic ligament, what would be your answer? No, definitely not. So, the cystic duct is not related to the free edge of the gastrohepatic ligament. Regarding the branches of the superior mesenteric artery, you know that the superior mesenteric artery, it gives iliocolic branch, appendicular branch, the right colic, and here would be the marginal anastomosis with the inferior mesenteric. So the anastomosis found between the superior mesenteric and the inferior mesenteric is marginal arteries, and these marginal arteries have got a surgical importance. Any obstruction in the major trunk may not give rise to gangrene of the part of the intestine, because due to this active anastomosis, the blood may travel from the other branches. So the marginal arteries are the site for the anastomosis of the superior and the inferior mesenteric arteries. And you know here that this is the superior rectal artery, which is the continuation of the inferior mesenteric artery. And this, if I say the superior rectal artery is the branch of the superior mesenteric artery, am I correct? No, definitely not. Regarding the portal systemic anastomosis, yes, the portal systemic anastomosis, this is the portal vein which is formed by the splenic vein and the superior mesenteric vein. The inferior mesenteric vein doesn't open in the portal vein. It opens into the splenic vein, and here the inferior mesenteric vein, it collects blood from the upper part of the anal canal. So the lower part of the anal canal doesn't receive blood in the portal circulation. Understand? So by this view, you can say that the upper part of the anal canal, although it receives blood into the circulation, but the lower part of the anal canal doesn't receive the blood to the portal circulation. Yes, you can see here that the inferior mesenteric gives rise to here, which gets open into the splenic vein, and the pudendal vein ultimately gets its blood supply from the lower part of the inguinal canal. So, as the pudendal vein is the tributary to the external iliac vein, which is again entered into the common iliac and the inferior vena cava, so it has no relation with the drainage of the lower part of the inguinal canal into the portal circulation. If I say to you that what are the different parts of the pancreas, what would be your answer? Head, body, neck, body, tail. What about back? Is it a part of pancreas? Back?
No.
Definitely not. Okay. Yes, regarding the abdominal plane, related to this view, in this view we have seen that the abdomen is being divided into 9 regions according to for our surgical importance. The iliac fossa, right and left side, right and left lumbar region, right and left hypochondric region. In the center we have got epigastrium, umbilical region, hypogastrium. So you see here in the center of the umbilical region there is no mark, not a horizontal, not a vertical division. So the umbilicus is the site where no plane is reaching. Okay? So if I say you that in the divisions of the abdomen, different 9 quadrants, abdomen umbilicus lies in a plane. What would be your answer? Definitely not, because umbilicus lie in the central part of the umbilical region. So no ever plane crosses it, neither horizontally nor vertically. Okay. Regarding the inguinal canal, you see that this is the superficial inguinal ring and here is the deep inguinal ring. And just in front of it will be the anterior to it will be the external oblique, internal oblique. They lie in front, and behind would be the transversalis fascia. So if I ask you that what is the weakest area of the inguinal passage, what would be your reply? Either anterior, posterior, superior, inferior. Inferior?
Yes.
Inferiorly, we have got a strong bounding by the inguinal ligament, isn't it? Inferiorly, you can see here that the anterior superior iliac spine and the pubic tubercle, we have got inguinal ligament, the facial aponeurosis of the external oblique. So, behind would be the most weakest area, posterior side is most weakest in the inguinal passage. This is formed by fascia transversalis, isn't it? So, only one thing, fascia is there, so the weakest site for the, please don't talk, please don't talk. The weakest side for the inguinal passage would be the posterior, okay? The posterior wall. Related to the inferior epigastric vessels, you know from where the inferior epigastric vessels are arising? related to inferior epigastric artery. From where inferior epigastric artery arises? Yes? No, not internal, external area. So it starts from the abdomen just above the inguinal ligament and it ascends up. You see, this is the rectus abdominis. If you want, I have dissected a body in which I found the inferior epigastric, the course, whole course of the inferior epigastric artery related to the deep inguinal ring. In that cadaver you may see. So that is the inferior epigastric artery, which is arising from the external iliac artery. It is lying inferior and medial to the deep inguinal ring. So when it arises just above the inguinal ligament, it is lying inferior and medial. You see here, this is the lateral view. This is the deep ring, this is inferior and medial to it. So this is the relation of the inferior epigastric vessel related to the deep ring. Clear? Clear? Okay. So related to the celiac trunk, this is the abdominal aorta, the anterior branches of the abdominal aorta would be celiac trunk, superior mesenteric, inferior mesenteric. Here I am talking about celiac trunk. What are the three branches of the celiac trunk? Left epigastric, splenic, hepatic. Okay. If I say that ilial branches coming from the celiac trunk, am I true? Definitely not. Jejunal and ilial branches are coming from where? The superior mesenteric artery, gastroduodenal artery, right colic artery, middle colic artery, iliacoelic artery, jejunal ilial branches, all are the branches of the superior mesenteric artery. So ilial branches are not coming. Listen to me please for only few minutes. Then you can talk. Otherwise you will complain later on that we didn't understand. Okay? It is for your benefit, not for me. So, regarding the another question, what this diagram shows? The vascular arcade found in the jejunum and the ilium. If I say, what if if a surgeon opens the abdomen after removal of the skin and the muscular layer, he is now removing, reflecting the layer of greater omentum. If he wants to distinguish between the jejunum and the ilium, what is the obvious finding from which he can differentiate between jejunum and ilium? Whether the plica circularis, the difference, the obvious difference. Because I said that he has opened the abdomen, he didn't make an incision in the gut. Plica circularis lies inside. Whenever you open the jejunum or ilium, so in the jejunum you found plica circularis. But plica circularis is not present in ilium. Why? Because due to the deposition of pars patches. So this is the inside view. He is not opening the gut. He is not making an incision into the gut. How can he differentiate? He can differentiate by means of the vascular arcade, vessels found in the mesenteric. isn't it? So the pattern of the mesentery in the jejunum and the ileum, remember this. This is the only pattern through which a surgeon can differentiate between jejunum and ileum. Next question related to it, you know that in the heart, the musculature, the myocardium is never continuous from atrium to ventricle. Am I right or wrong? If I say that myocardium is never continuous from atrium to ventricle, am I right?
Right.
Yes. Yes. The only site from where all the nervous impulses may travel from atrium to the ventricle is through the specialized myocardium. SA node, AV node, bundle branch, bundle of His, all that. Purkinje fibers, all that. Okay? So, regarding the site for the AV node, you know that the fibrous skeleton of the heart, it has the mitral valve, tricuspid valve, aortic and pulmonary valves. In it, this is the cross section. In it, we have got the left fibrous trigone, this is the site, and this is the site for the right fibrous trigone. So the right fibrous trigone is the site where AV node and bundle of His lies. If I say bundle of His or AV node crosses the left fibrous trigone, am I right? No, definitely not. If I say the AV node, the site of AV node is the right fibrous trigone, am I right? Of course. Okay.
Doctor, this point,
To really understand?
yeah.
You see here, the fibrous skeleton of the heart, it encircles, it surrounds the valves. What are the valves? Present between atrium and ventricle, right and left side. The tricuspid and the bicuspid valves. And in addition to that, two other valves, semilunar, aortic and pulmonary. Okay? So, this is all the fibrous skeleton of the heart. And this is the side which is the most left, on the left side. This is the left fibrous trigone. This is the left fibrous trigone. And here, this is the right fibrous trigone. AV node and bundle of His that lies in the vicinity of the right fibrous trigone, because it will have to give supply to both ventricles, right and the left. So the site for AV node is the right fibrous trigone. You can see here, this is tricuspid valve, this is mitral valve, and this is the site for the AV node, right fibrous trigone. Inferior rectal artery is the branch of pudendal artery. Pudendal artery. Inferior rectal artery, this is the inferior rectal artery which is coming from the pudendal artery. This is levator ani. Below the levator ani, the pudendal artery gives off a branch to the inferior, to the rectum and the anal canal. This is inferior rectal artery. If any sort of infection comes into in the pelvis of a female, which is known as pelvic inflammatory disease. The sequelae of pelvic inflammatory disease, in which the female has got inflammation in this pelvic region. Okay? Pelvic inflammatory disease in which there is infection or inflammation lie in these areas: utero-vesical pouch, pouch of Douglas, recto-uterine pouch. If I want to do culdocentesis, this is called cul-de-sac. This is called cul-de-sac. So if I want to draw fluid, pus, from the cul-de-sac, from exterior approach, I should have to insert a needle through the vagina, which passes through this is the posterior fornix. This is the posterior fornix of the vagina. So I should have to pierce the posterior fornix of vagina to enter into the cul-de-sac. So if I say the needle can pass through uterus, am I right? No. If I say the needle is passing through anterior fornix of the vagina, no, because the needle is straight. I should have to go straight. So the only answer is the posterior. It is the posterior fornix through which the needle can be passed in the cul-de-sac for culdocentesis. Okay? Yes. Regarding the lower half of the nerve supply of the lower half of the anal canal. This is having the pudendal nerves which is supplying to this area, and it bears types of sensations. For example, if I am telling you the pain sensation, temperature sensation, touch sensation, and stretch sensation, 4 sensations. If I say this is the lower part of the anal canal, bears all of the sensations except one. What it could be? Stretch. Because this is the quality of the autonomic system. As this is coming from S234 segment from the sacral plexus, somatic nerves, the somatic nerves bears all sensations, pain, touch, temperature, even position, but not the stretch. So stretch sensation is not present in it. You see, this is the anterior view of the heart, revealing out the ascending arch of aorta and the descending thoracic aorta. This is the trachea, which divides into 2 principal bronchi, and here is the esophagus. You see, this tube lies exactly behind which part of the heart? Esophagus lies exactly behind which chamber of the heart? Obvious, left atrium. This is a very small view. I think you can appreciate it with great difficulty. What is this structure? Spleen. What is this structure? Pancreas. What is this? Transverse and descending colon. What is this? Left colic flexure. What is this ligament called? No. What is this? Connecting colic flexure with the diaphragm, under surface of diaphragm. Phrenico colic ligament. Okay, I have chosen this view. Why? Because this is very small view. Why? Because it gives a good impression related to the question. The phrenic-colic ligament lie inferior to the spleen. You see, this is spleen. This is the phrenic-colic ligament. Lie inferior to the spleen. What is the normal position of uterus? Anteverted and antiflex. What happens? Is it the position in empty bladder or a full bladder? Empty bladder. Okay. Okay, this is the view of the lungs, the cut sections of the ribs, diaphragm. This is costodiaphragmatic or costophrenic recess. This is cardiophrenic recess. Okay, and this anterior edge of the lung forms the costomediastinal recess. The lower anterior edge border of the lung forms the costomediastinal recess. Again, the costophrenic recess and cardiophrenic recess. So you should have to identify these things. You see, the recesses, the sites where the pleural fluid may accumulate, is costophrenic, cardiophrenic. This is costophrenic, this is cardiophrenic. This is cardiophrenic, costophrenic. This is the recess which is formed by the anterior border of the lung, and this forms the costomediastinal recess. So this is the costomediastinal recess formed by the anterior border of the lung. What is the name of the second part of the uterine tube? What are the parts of the uterine tube? Yes. What are those? No, what are their parts? You know?
We know ambulla.
علاش بيسأل؟
I am not talking about uterus. I am talking about uterine tubes.
الفالوبيان تيوب بيسأل عن البورت.
What are those? The fibria. You see? The fibria, finger-like projections. Infundibulum. The infundibulum is the widest part of the uterine tube. Then comes the ampulla. Then comes the isthmus. Then comes the intramural part, lying in the uterine cavity, wall of the uterine cavity. So,
دكتور سحب عليه.
the second part of the uterine tube, which is intermediately dilated, which covers the ovaries from above. This is called infundibulum.
انفندبل انت لا تحفظ الحروف الاخيره بس نمشي اول شيء انفندبل بس ايش حكايه امبولا؟
If I say choose a vessel which is unpaired, I am telling you 4 or 5 options. Choose the vessels which is unpaired. Coronaries. See, renal, suprarenal, gonadal,
Yes.
Superior rectal.
Superior
Rectal.
superior rectal.
Unpaired.
Superior rectal. Superior rectal.
يحيى قال كده يعني صح.
Superior rectal artery is the unpaired among all which I have mentioned to you. Unpaired, no pair, no right and left, only one. And which is the continuation of superior rectal artery? What is the name of the artery? Which is the continuation?
Inferior gastric.
Inferior mesenteric artery gives rise to superior rectal artery as its continuation. Regarding, if I am telling you about the portal systemic anastomosis, regarding portal systemic anastomosis, the anastomosis choose the site where this anastomosis is not found. Okay? Gastroesophageal junction. The anastomosis found at gastroesophageal junction, portal systemic. Is it right? Of course. Right. Okay. Posterior abdominal wall. Again, this is true. This is the anastomosis found in the posterior abdominal wall.
أنا ما أدري.
Rectum.
دي فرحانة قال.
Superior ولا inferior?
Okay. If I tell you the gastrohepatic site, site, is it true? Site, S-I-T-E. Anastomosis. Portal systemic anastomosis. This is the only wrong answer. Okay?
Gastrohepatic.
Umbilicus, around umbilicus, gastroesophageal junction, posterior abdominal wall, rectum, these are the sites for the portal systemic anastomosis. Whenever anastomosis, portal hypertension occurs, bleeding occurs through vomiting. This is called hematomesis. In hemorrhoids, bleeding through the hemorrhoids in the lower anastomosis. In umbilicus, we have got caput medusae, spider's web-like arrangement, vessels radiating outward from the umbilicus. Posterior abdominal wall, discoloration in the flanks. So, the only side which is not having this anastomosis is gastrohepatic. What are the names of the pouches present in the intestine? Names of the pouches present in the intestine, large intestine. Appendices, if you like. True or false? Who said true? False. Tinea coli. Tinea coli. Pouches in the wall, not I am talking about any other thing, in the mesentery, not mesentery. In the peritoneum, not in the peritoneum, in the wall. Walls. Okay? What are those? They are called hostrations. Hostrations. H-A-U-S-T-R-A-T-I-O-N-S. Regarding the major vein area of the liver, on which surface of the liver this vein area is found? Anterior, superior, posterior, inferior. It may reach up to the superior, but ideally it is found in the posterior. Found between the two coronary ligaments that goes as triangular ligament. On the other side, inferior vena cava. So, most of it found in the posterior. Okay? Regarding the venous drainage of the heart, coronary sinus, and great cardiac pain, true?
Hey.
Yeah, but
Great cardiac pain, true. Middle cardiac pain, true. Vena cordis minimi, true. Why?
كده أنا ما يعجبني
أنا ما
ما يعجبني
Why? Why? Very simple question.
والله ترجم هو شيء بعد
Because it directly receives venous blood from the chambers of the heart. Again, true. If I said internal mammary artery, internal mammary artery is not related to the venous drainage of the heart.
دكتور كان يريد دكتور
يا يحيى اجيب لك حل هذا سؤال المال الحل الصغير لا يتحمل
روبن هذه ما يتحمل
دكتور
Regarding the posterior relation, please don't talk, otherwise I leave. Don't talk, otherwise I will leave because I have a duty invigilation at 12:30. Okay? Just give me time to complete it within due time. It's to 12:30. So, related to the posterior relation of the kidneys, I am giving you the options. You will said to me which is incorrect. Okay? Diaphragm.
Could you repeat that question?
You are not attending intentionally. You see, your mind is not here. What I am telling you, because I have to leave in few minutes. Listen, I won't repeat it. Related to the posterior relation of the kidneys, which is false? Diaphragm?
No. True.
Psoas major muscle?
True.
Quadratus lumborum? Transversus abdominis? Erector spine? Why? This erector spine group of muscle lie on the back, posterior side, not facing the abdomen. So this is the only false. Which muscle is not forming the walls of lesser pelvis? Walls of lesser pelvis. Psoas major? True. But that forms the walls of the pelvis, lesser pelvis. Piriformis? Yes, definitely. Obturator internus?
Yes.
Yes. Iliacus?
Yes. لا فوق
You are not getting good marks.
We know that.
No, this is not related.
يا شيخ خذ
لو انا كنت العارفه
This is human anatomy, not the anatomy of marsupials.
ايش اول واحدة كانت؟ قبل البايريفورمس.
قبل نسمع ايش اول واحده؟ هذا اللي بيدخل قدام الجواب ايش اول واحده؟
The neck of the oblique inguinal hernia. The neck of the oblique inguinal hernia lies medial to the inferior epigastric artery. The neck of the oblique inguinal hernia lies medial to the inferior epigastric artery. This is false, definitely, no doubt about it. Costomediastinal rectus, I told you, vein area. Vein area of liver lying between inferior vena cava and two coronary ligaments. Vein area of the liver lies between inferior vena cava and the two coronary ligaments. True. What is the answer? True or false? True.
True. Very true.
Because on one side inferior vena cava, fossa for inferior vena cava, on the other side, right, the triangular ligament, the two coronary ligaments in it, vein area is found.
بكتب كل اسمين غلط. خرب لي
Okay, I think you people understood all these things.
ان شاء الله ان شاء الله.
we hope.
والله أنا أعرف.
الحمد لله انك تعرف.
والله